Interview and reaction on nurse practitioner full practice authority. Health policy issue. The interview focus was on full practice authority for Texas nurse practitioners seeking to expand healthcare access. I selected Texas State Representative Erin Zwiener because she represents my home district. She has served 2 terms and is a member of the House Committee on Public Health, Health Administration, and Appropriations, where she is the vice chair of the Subcommittee on Education, and she established the Caucus on Climate, Environment, and the Energy Industry and serves as its chair. There are currently 24 states plus the District of Columbia which permit full practice to nurse practitioners upon earning a license. The former Institute of Medicine, which is now the National Academy of Medicine, Future of Nursing report identified regulations restricting nurse practitioners' scope of practice as one critical barrier in addressing the shortage of primary care services in the U.S. Health policy issue continued. More than 75% of nurse practitioners provide primary care services, and research supports that nurse practitioners provide equivalent or higher quality care compared to physician colleagues. The National Council of State Boards of Nursing recommend NPs practice to the full extent of their education and training to address primary care access challenges. In September 2017, the Department of Veteran Affairs Healthcare System released Directive 1350, authorizing full practice authority across the organization. However, NPs must still adhere to the laws of the state where the facility is located. In communities where underserved and vulnerable populations reside, when collaborating physicians leave the area, nurse practitioners are unable to care for these patients without full practice authority. Interview preparation. To prepare for the interview, I searched the University of Texas Library database for articles on barriers to full practice authority. I used the House of Representatives website to find Representative Zwiener's biography to ascertain her committee membership. Legiscan.com and Texas Legislature Online were used to search for NP full practice authority bills from the previous legislative session. I was able to locate House Bill 2029, which was introduced by Representative Stephanie Click and died in committee. Meeting reaction. Representative Zwiener shared that she has voted in favor of full practice authority for nurse practitioners. However, she admits that she is on the fence regarding full practice authority and could be swayed one way or the other. Reasons for this include the current Texas supervising physician structure, where the physician is not required to practice within the same discipline as the nurse practitioner, as a reason for supporting full practice authority. She described certified registered nurse anesthetists administering anesthesia without supervision as a reason against supporting full practice authority. I shared that I was in favor of a transition to practice residency period for entry into NP practice to obtain full practice authority, and Representative Zwiener thought this avenue toward full practice authority had merit as well. Health policy interpretation. Although Representative Zwiener has supported full practice authority for nurse practitioners, she verbalized that she could be swayed to vote against full practice authority in the future with a strong pitch from the Texas Medical Association. This would not change current access to primary care for Texans. Passage of full practice authority would increase primary care settings and subsequently improve patient access while decreasing wait time to see a provider. I feel that passage of full practice authority with a transition to practice residency safeguards both nurse practitioners and patients while also expanding access to care, especially in communities with underserved and vulnerable populations. DNP role, policy importance, and future application. The COVID-19 pandemic brought attention to the primary care system's inability to meet the demand for healthcare services, which is predicted to rise by nearly 20% over the next 5 to 10 years. DNPs are poised to help shoulder the increasing primary care burden through full practice authority while reducing costs through application of evidence-based practice guidelines in the ordering of diagnostics, treatments, and medications. Nurse practitioner full practice authority was brought forth by executive orders during the COVID pandemic and should provide a pathway forward for promoting full practice authority for primary care NPs across the U.S. Through their education and training, DNPs are prepared to lead the charge toward full practice authority. This experience has taught me that legislators are available to speak with their constituents regarding policy, and that they value input from experts within their respective fields. Therefore, DNPs can have a real and lasting effect on healthcare policy. These are my references. Thank you.